Hi folks, thanks for joining me for Medicare 101, Understanding Your Options. Just please note that the presentation is educational in its purpose and no plan-specific benefits or details will be presented or shared at this time. I'm Florence Goins, a full-service broker agent and owner of Oklahoma Health and Life Insurance in Oklahoma City. My specialty is health insurance and risk management products for middle-income Americans. I've helped hundreds of individuals just like you understand the basics of Medicare and additional coverage options available to fill the gaps, simply in everyday language. So let's get started with the question, what is Medicare? Most people know that Medicare is a government health insurance program for folks 65 and older and certain individuals through disability or special circumstances. Generally, your eligibility for Medicare is assured if you or your spouse worked for at least 10 years in Medicare-covered employment and you're 65 years or older and a citizen or permanent resident of the United States. If you are not yet 65, you may also qualify for coverage if you have a disability or end-stage renal disease, which is permanent kidney failure requiring dialysis or a transplant. As you approach Medicare eligibility, it's easy to become overwhelmed trying to understand the different parts of Medicare, the eligibility requirements, enrollment periods, coverage and gaps, and optional coverage to fill the gaps. Today I'll help you with the critical ABCs and D of Original Medicare, and once you've digested this part, you can join me for the second video lesson on additional coverage options. With Original Medicare, there are four main parts. Part A is hospital coverage, also known as inpatient. Part B is medical coverage, also known as outpatient. Part C, Medicare Advantage program. And Part D is the prescription drug plan. Part A of Medicare is hospitalization. It covers inpatient care in hospitals. It covers inpatient care in a skilled nursing facility. However, that is for a limited period of time, 100 days maximum per admission. It is not the same as long-term care. It is not full-time nursing home care. Part A also covers hospice care services as well as home health care services. Part B of Medicare is medical insurance, also known as outpatient services and surgery. It covers your doctor's visits, it covers outpatient hospital care and other medical services, including durable medical equipment. It also is going to be the part that's responsible for paying for lab services and tests like CAT scans, PETs, MRIs, and that type of thing. Part C of Medicare is the Medicare Advantage program. It is a health plan option run by Medicare-approved private insurance companies. They must provide all the benefits of Original Medicare because an Advantage plan actually is an alternative replacement for Original Medicare A and B. The Advantage plan will provide all of your Part A hospital coverage as well as your Part B medical coverage. It may offer extra coverage that Medicare does not cover, like vision, hearing, dental, and or health and wellness programs. Most of them will include Medicare prescription drug coverage as part of the plan embedded in the program for no additional cost. And the last part of Medicare is Part D, the prescription drug program. It is a Medicare prescription drug plan administered by Medicare-approved private insurance companies. It can be purchased as a standalone insurance plan in addition to Original Medicare and or a Medicare supplement, or may be included in a Medicare Advantage plan. It will help cover the cost of prescription drugs. It may have deductibles and co-sharing or cost sharing in the form of co-pays and co-insurance. A co-pay is a set dollar amount and a co-insurance is a percentage of a cost. So you may be familiar with co-insurance on employer plans of 80-20, 90-10, 60-40, and so on. A particular copay would be the amount you pay when you go see the doctor, so somewhere between $10 a visit to $35 a visit. To be eligible for a prescription drug plan with Medicare, you have to have either Part A of Medicare or Part B of Medicare. The prescription drug plan is probably one of the most difficult to understand parts for most people, so let me help you to understand that it has basically 4 levels of coverage. The first one is the deductible, and it's $320 for this year. The second level is the initial coverage limit. It's $2,930 for 2012. The third level is the donut hole, or otherwise known as the coverage gap. It's $3,727.50. And the last level of coverage is called catastrophic coverage. But before we get to that, let me explain how the initial coverage limit works. That $2,930 is not going to be paid 100% by you or by the insurance company. There is a 75-25 split. You pay about 25%, which is $652.50, and the insurance company will cover the balance of $2,610. Once you have both spent your dollar amounts, that's when you go into the third level of coverage, or the donut hole. In the donut hole, you're going to pay out of pocket the next $3,727.50. The good news is that while you're in the donut hole, name brand drugs will only cost you 50% of whatever their normal retail is. The pharmaceutical companies are subsidizing the other 50% through an agreement with the Centers for Medicare and Medicaid, and you will get that discount at the pharmacy counter. If you're taking generic drugs, you'll get a 14% discount off of those in the donut hole, and the insurance company will be covering that portion of it. Once you have spent out of pocket a total of $4,700, which includes your co-insurance and co-pays but not your monthly premiums, you will have reached catastrophic coverage. When you're in catastrophic coverage, which is the last level of coverage, you will have spent $4,700 out of pocket, and you will begin to get some very low co-pays for the rest of the year. You will pay the greater of $2.60, which is $2.60 for a generic or a preferred multi-source drug, and $6.50 for all other drugs, mostly name brand, or a 5% co-insurance. Mostly that would be for specialty type drugs. For people with special situations of limited incomes, there's a program that's available, and it's called Extra Help or Low Income Subsidy. And if you qualify for that Extra Help program through Medicare, then you will not have any premiums for your drug plan, and you will start out at the catastrophic level. You will pay no more than $2.60 for a generic or $6.50 for a name brand, and there will be no donut hole for you. So it can be very advantageous if you qualify, and to find out if you qualify, you contact Medicare, Social Security, or the Department of Human Service to see what the qualifications are for your particular state and to get an application to apply. As you approach age 65, you'll have a 7-month window of time during which you can enroll in Medicare Parts A and or B. Your initial election period begins 3 months before the month of your birthday. It includes the month of your birthday and 3 months following your birth month. If you sign up in the 7-month window, you will avoid late enrollment penalties. However, your coverage may be delayed depending on the month you enroll, as we will discuss on the next slide. Your Part B coverage will become effective depending on when you sign up for it. If you sign up 1 to 3 months before you turn 65, then the month you turn 65, you'll be covered the first of that month. If you enroll the month you reach age 65, your coverage starts 1 month after your birthday month. If you wait a month after you turn 65, then your coverage will start 2 months after the month of your enrollment. And if you wait 2 to 3 months after you reach age 65, your coverage starts 3 months after the month of your enrollment, not your birthday. So that's important to realize, be aware of, and understand those effects. Some further information on the horizon of your enrollment in Medicare Parts A and B that a lot of people are not familiar with is that if you are receiving Social Security or Railroad Retirement benefits, you're automatically enrolled into Parts A and Part B of Medicare by Social Security. If you're not receiving Social Security or Railroad Retirement benefits, then you can begin to sign up 3 months before you turn age 65. What's important to understand is that many baby boomers are delaying the receipt of Social Security in order to receive full retirement benefits. Many of those people are not aware that there is no automatic sign up for Medicare Parts A and B if you delay Social Security. So it's very important to remember, if you're delaying Social Security, which many boomers are these days, you must remember to sign up manually for Medicare Parts A and or B. The reason it's so important for you to sign up at the right time is so you can avoid penalties. What are penalties? Medicare refers to them as late enrollment penalties, and they're assessed on Parts B and D, which are voluntary, meaning you do not have to take them if you don't want them, or if you have a valid exception. What that means is that you have current coverage that is as good as or better than original Medicare. If you don't have a valid exception and you fail to enroll when you're first eligible, penalties will accrue. They will be assessed when you do enroll and will continue for as long as you continue your coverage, which for most of us is a lifetime. The Part B penalty is 10% of the current Part B premium for each year that you delay without a valid exception. The Part D penalty is 1% of the average national drug plan cost for each month you go without creditable coverage. In 2012, that equals about $3 a month, which is 1% of the average national drug plan cost, which right now is running about $30 a month. One other enrollment period that you need to be aware of is the 6-month Medigap open enrollment period. The Medigap open enrollment period is for a Medicare supplement, and it starts the first month that you turn 65 and are enrolled in Part B. During this time, you have a guaranteed right to buy any Medigap policy or Medicare supplement policy sold in your state, regardless of your health status. Once the period starts, it cannot be delayed or replaced. The reason this is important is because if you are on a group employer plan or another exception situation where you have coverage and you have it as a guaranteed coverage and you turn 65 and you go past your 6-month open enrollment period, you may not qualify in the future for a Medicare supplement because it is not guaranteed issue after age 65 6-month window. It's an insurance product. It is not a Medicare product. It is secondary to Medicare, and you do have to go through underwriting if you miss your open enrollment period for Medigap or Medicare supplement. So it's very important that if you're considering a Medicare supplement, that you definitely enroll within your 6-month Medigap open enrollment period. The last set of enrollment periods are dates that you will become familiar with as a Medicare beneficiary. These are annual enrollment periods for Medicare beneficiaries, and what they're for is to allow you to make changes to plans, either to your Advantage plan that you're in or prescription drug plan. The reason it's important to understand these products is because Advantage plans and prescription drug plans are Medicare products, whereas a Medicare supplement is an insurance company product. That is something you could actually make a change to anytime during the year. Not recommended, since if you ever disenroll from a supplement, a Medicare supplement, you may not requalify to get it back. But it is not regulated regarding enrollment periods and dates the way Advantage plans and prescription drug plans are. So for pre-enrollment each year, it begins October the 1st and it runs through the 14th of October. During that period of time, insurance companies can market to you, but they cannot actively enroll you. Annual election period is actually used to be called open enrollment. During that period of time, insurance companies can make changes. They can actively enroll you into an Advantage plan or a standalone prescription drug plan. Those dates are the 15th of October through the 7th of December. Once that period is over, you have one more opportunity to make a change to an Advantage plan. This annual disenrollment period is specifically to disenroll from an Advantage plan. You can do that between January 1st and February 14th. You cannot use that period to disenroll from an Advantage plan to re-enroll in another Advantage plan, but you can disenroll from your Advantage plan, go back to original Medicare A and B. If you choose, you can also elect, if you can qualify, for a Medicare supplement and add a standalone drug plan during that time. After that, you're in lock-in. And lock-in is from February the 15th through the 14th of October. That's a little misleading in that if you are, whatever plan election changes you make between January 1 and the 14th of February, the plan that you are in that year is actually going to be the one you're in through the 31st of December. Okay, but you can begin to look at and make election changes for the following year, again, during your annual election period, October 15th through December 7th. There are premium costs for Parts A and B of Medicare. Most people who have worked in the United States for at least 10 years and have paid into the system through payroll deductions will not have a Part A monthly premium. But everyone will have a monthly B premium if you elect to take Part B. Because again, remember, it's voluntary. For 2012, the standard premium is $99.90 a month for most people. If you make higher than $85,000 a month income, not a month, $85,000 a year as an individual, or $170,000 a year as a married couple, then your portion of the premium for Part B will be higher. It can be as high as $319 and something cents a month, and it's a sliding scale, but the majority of people will pay the standard monthly premium of $99.90 a month. In addition to your monthly premium for Part B, there are other costs that you will be incurring with original Medicare. The first one is the deductible for Part A hospitalization. It's $1,156 per admittance. Okay, so it's not once a year, it's each time you're admitted into the hospital. The good news is that that covers the first 60 days of hospitalization. If you're still in the hospital after 60 days, for the next 30 days you have a copay of $289 per day. If you're still in the hospital after day 90, you will be able to use once in a lifetime an additional 60 days. There are copays for those days of $578 per day, and if you ever use them up, then they are gone forever. If you're in the hospital after day 150, that first time, there's no additional coverage. Medicare is through paying, and it's 100% out of pocket for you. You do have skilled nursing coverage of 100 days covered by Medicare. The first 20 days are covered 100% by Medicare. The next 80 days, you have a copay of $144.50. If you're still in skilled nursing care after day 100, there is no further coverage from Medicare for you. It's 100% out of pocket. For 2012, you have a Part B deductible, which is an annual deductible of $140. Once you have met your deductible, then you go into the co-insurance phase, which is 80-20. Medicare pays 80% of your Medicare eligible expenses, and you pay 20%. Your Part D prescription drug deductible is $320 unless the plan that you are enrolled in covers that deductible, which some do. So as you can see, Medicare is a great program, and it does cover a lot, but it doesn't cover everything. So what does it cover, and how much does it cover? It covers, Part B anyway, covers 80% of Medicare-approved medical expenses, and that is huge. That is why, for the most part, when you're 65 and above, your Medicare and your medical insurance is much less expensive because Medicare is covering a huge chunk of it. So, who's responsible for the other 20%? That would be you, unless you have supplemental coverage. And that supplemental coverage could come in the form of a Medicare supplement, and a Medicare Advantage plan, an employer or retiree coverage plan, TRICARE, VA benefits and Indian health benefits, or Medicaid. I've given you a lot of basic information, and there are a lot more sources of information that you can peruse on your own to get even more detailed information about Medicare. One of them is Choosing a Medigap Policy, a guide to health insurance for people with Medicare. It is put out by the Centers for Medicare and Medicaid in conjunction with the National Association of Insurance Commissioners. Its focus mostly is Medigap or Medicare supplement plans and policies. You can also get help from the State Health Insurance Assistance Program in your state. In Oklahoma, it's the Oklahoma Insurance Department. You can go to www.shiptalk.org. They have a great brochure available to give you information about Medigap, Medicare supplement policies. They will also help you with questions on original Medicare A and B, in addition to Medicare supplements or Medicare Advantage plans. And of course, you can always look through the Medicare and You Handbook, which you will receive once a year as soon as you apply for Medicare from the Centers for Medicare and Medicaid, or you can download your own copy, your PDF version, at www.medicare.gov. Well, hopefully now you better understand the A, B, C, and D of Medicare. Stay tuned to learn more about the additional coverage options available for Medicare, because as you now know, Medicare is great. It covers a lot, but it does not cover everything. Do you still have questions? If you do, it's understandable. Medicare is a huge program, but please take a little time and visit www.medicare.gov. Most of your questions can be answered on their website, which is also searchable. But please feel free to call us toll-free at 888-810-6678 with any questions you have, or if you'd like to schedule a complimentary, no obligation, personal appointment. We'd be happy to hear from you. We are here to help you to achieve your goals and prepare you for a safe and a worry-free retirement. Our hope for you and our wish for you is to enjoy your retirement to the absolute fullest. You worked very hard to prepare for it. We believe you deserve to enjoy it. I'd like to take this time to thank you so much for your time and your attention. I'm Florence Goins with Oklahoma Health and Life Insurance. I'd love for you to visit and learn more at www.okhealthplan.com, or call me if you're in Oklahoma City at 405-409-7884, or toll free if you're outside of Oklahoma City at 888-810-6678. We're here to help you, so please don't hesitate to call us. We look forward to hearing from you. Thanks again, and have a great day.